back on ttalk ek Boond Soch ki train of thoughts with the series of an episode with Dr. Viswanathan Iyer. He's a neurosurgeon and also a cycling man of Mumbai. So welcome to the show again.
Thank you.
So now, in fact, recently we have seen in Bengaluru Mr. Anil Kumar, like at the age of 45, of being an cyclist and the fitness trainer. There was a news regarding and he met with a heart attack, like.
Yeah.
What do you say about that? Is the cycling to do anything to do with the heart attack?
I think as a doctor, I see more patients coming with more problems who are not doing anything physically active rather than these one-off incidents of athletes having problems. I think what happens is that the hype in the media comes only for these fitness people or the gym people or the cyclists who have heart attacks. But the media tends to probably ignore the so many sedentary, obese, diabetic patients who have heart attacks every day, mainly because of lack of activity and lifestyle diseases. I think the logical answer to this would be is that each man has to know his condition, his limitations, probably before going into a very severe exercise program. You have to check yourself, so you can consult a cardiologist, do the necessary tests, and then go ahead with a health or rather cycling program. Now, I think it is also very difficult to compare person to person. Like if somebody who's cycling every day 30 does a 80 in the weekend, it is okay. But if somebody who's just doing 2 a day cannot do 80 suddenly.
Correct.
So we can never compare somebody who's been doing cycling for so many years daily and compare his fitness to our fitness.
Correct.
And try to so-called judge on his death. I think you have to respect that guy, or for that matter anyone. He's doing an activity out of his own choice. I'm sure he's made a good medical thoughts also before that. And heart attack can happen to the fittest of people also. It doesn't mean that if I'm really fit, I will never get a heart attack. So I think we need not correlate them that, directly.
Okay, so in short, it's not equal to the cardiac fitness, like physical fitness is not equal to cardiac fitness as such.
Really, what I'm trying to say is that, see, people generally tend that, okay, is it overdoing?
Correct.
Okay, but what is the meaning of overdoing? Now, people play T20, they play 50 over matches, they play 5-day matches because they are fit to reach that level.
Correct.
I mean, this person has been doing it for so many years regularly.
Correct.
He's fit to do it.
Correct.
Today, if I'm going to start at 2 and 5 and 10. So it is not as if you do more and your heart gets injured or something. You have to do it in a gradual way. Definitely, exercise helps the heart. I think in one single line, if I have to say so, aerobic exercises being done regularly, which may involve cycling or jogging or running or swimming or anything like that, is going to be helpful for the heart. So let's not get confused by these pictures of heart attack happening to fitness people. They are one-off incidents and they should not be used to your daily thoughts.
How do you say, like, basically most of the cyclists who tend to be a smoker also, so there the chances of attack can be on the higher side? Definitely,
smoking itself is one of the big risk factors for heart disease and for stroke. And if you are pushing your heart limits and by cycling, if your heart is already compromised by smoking, definitely it will create a part on increasing the incidence of heart problems.
Okay, now looking at the cardiac aspects, like, what do high intensity exercise do to the heart, like?
Okay, this is very complex and long, but ultimately, if you demand the heart to pump more, the heart's efficiency increases. So if you compare the basic pulse rate of any human being, the pulse rate is from a 60 to 80 is considered normal. So a normal person with a sedentary lifestyle with no aerobic exercise, his pulse rate may be 75 to 80. Whereas the real good athletes like a Usain Bolt maybe, his pulse rate may be 36 or 42 or 45. So if you have a lower pulse rate, it basically means that your heart is so strong that in one pulse itself it can pump enough blood to survive or rather to nourish your body. So ultimately an athlete has to work towards lowering his pulse in such a way that the heart's pumping is less number but more effective.
Good. I think this kind of insights are going to helpful to a cyclist as such. then how do I know that I'm at a risk? Many a times I just pedal, and then how do I know I'm at a risk? Like,
I think risk stratification also depends upon at what age of your life you start doing certain activities. I think if a 20-year-old guy wants to cycle, let him cycle, let him be free. He doesn't need to do any medical test before that. Okay. But if you start at 40, 45, if you have been very sedentary all throughout and suddenly one morning you want to cycle. So these age groups and these criteria patients should do basic evaluation. So I would suggest just meet any cardiologist. He will run a few tests, which may include a few blood tests, maybe a ECG or a 2D echo. And if these things are in good order, you can start with a gradual cycling program under supervision of either a senior cycling colleague or a fitness instructor.
Many times you might have seen, like right from childhood, like if a person is habitual of going to gym and doing a gym on a regular basis, like throughout his life journey.
Correct.
And probably once he is about 60 and all, and if we switch from gym to cycling, like, so I think maybe probably as a sports person, like which like how your body maybe responds to that.
Yeah.
And then maybe I've seen various cyclists at 60, 66 and 72 also. They do 50, 60, 75 kilometers at a stretch.
Very comfortably. In fact, that is one more reason rather why I cycle. Because every morning I get to cycle with someone who's probably my father's age and is better than me. And the same time I get to cycle with someone who's my son's age and I'm better than him.
Correct.
So I think age is no more a defining factor for any limits of what you should set for yourself. You must evaluate, you must know your own body and your limits, but just don't let age affect your expectations or mileages.
Good, thanks. I'm sure like it's many of I would say senior citizen, also young cyclists, I would say about 60, while listening to Dr. Viswanathan, I'm sure like it's if you should know your body, like to what extent it goes. Good. Then secondly, is there any limit to the heart capacity?
Honestly, no. Honestly, no, because if you see athletes, you must be flabbergasted of how they can do these ultra marathons and they do 50 and 100 kilometers. And so I think it is just a matter of training over a gradual period, if required, under supervision of a better person. So I think there is no real capacity to the human body.
Great. Dr. Viswanathan Iyer, it was nice talking to you. I'm sure there's a great insights being as a medical professional and also as a cyclist and the cycling mayor of Mumbai. And I'm sure the word of an advice or the precautionary measure or the insights what you have given will motivate a lot of the cyclists who or the maybe as far as the sports person, like going to inspire to them. Though Dr. Viswanathan Iyer met with couple of an accident, but still like if like basically जिगरा है, जिगर है और कुछ करने की इच्छा है, तो I'm sure like it's an as far as ttalk audience listening to him will get an inspiration, and I'm sure like it's this what ttalk platform is all about, where we invite prominent personalities like Dr. Viswanathan Iyer on our show and to get the insights and get motivated through his stories and the insights of his life experience. So thanks a million for being part of this show and enlightening our target audience with your experience, expertise and the passion as far as the cycling which are concerned. God bless you in abundance.
Thank you so much.
Thank you.